Aloha Akakū, e Komomai. The regular meeting of the Council on Aging is called to order. I'm Chair Ed Ronson, and it is now 12:30 on June 9th, 2026. We're meeting via Teams teleconferencing and in person here at the Cameron Center. For the record, Staff Secretary Angela Danish will be taking the roles. We need 8 council members to have a quorum, and I think we have that. All members joining virtually, your camera needs to be on at all times, please. Angela.
Okay. Council members, when I call your name, please respond if you are present. For those attending virtually, in accordance with the Sunshine Law, please also state the name of anyone else in the room present with you at your location. Member Chase Traffigan.
Hi, present. I'm at home just with my infant.
Hi, Chase. Welcome. Member Corazon Vale Cox. Present. Member Deldry Manera is tentative today. Member Elaine Slavinsky is excused today. Member John Tomoso.
I'm here with my 4-legged.
Hi. Member King Van Nostrand.
Present.
Member Larry McCarty.
Present.
Member Lehua Parr. Not on the call yet. Member Margaret Hanson. Don't see her. Member Monica Rebella. Member Monica.
She's muted. Monica, could you unmute? There we go.
Okay, sorry, I am here recovering from surgery and no one's here with me.
Thank you. Member Nani Watanabe. Present. Member Shane Sinensi.
Aloha, here at my home office, here by myself. Thank you.
Turn it up. Member Valerie Kalaniopio Cook is not present, and Vice Chair Heather Ruth Durham not present. Chair Robson
Here.
here. Okay, thank you. 2, 3, 5, 6, 7, 8, 9. So thank you, members. We have 9 members present, and we have quorum to conduct the meeting. On our end, I'm going to go ahead and adjust our settings. Our sound is very quiet. Let me see. Can I have a volunteer to speak to test if our sound is working?
Shane, could you give us an aloha?
Aloha, check 1, 2, 3.
It's still a little bit low. We're working on it, though.
I wonder if in Teams.
Well, we'll drive on, and Angela will fix this. I'm confident. Right. So I want to remind all council members that unless you're speaking, please mute yourself. I will remind you if you're still muted while you're trying to talk. We'll try and keep track of that. And also, for the record, please identify yourself every time you're speaking. Angela's taking the minutes and will take the minutes from the recording. And so it would be helpful if you could identify yourself. Let's see. Last month, we didn't really have the opportunity to welcome our newest member. So I want to welcome member Rebella. She's here, isn't she?
Yes.
There she is.
That's me.
We wanted to give you an opportunity to introduce yourself. So tell us about yourself, please.
Hi, everyone. Very happy to be part of the Council on Aging.
1 second.
Can you hear me? You can hear me? Hello? Can you hear me?
Somebody say something.
I can, not sure if they
Monica,
can.
we're having trouble hearing you. Could you say aloha again?
Hello, I'm Monica Rebella.
Yeah.
Can you hear me?
Sorry about this.
Other member?
We wanted her to introduce herself.
Yeah, we just need to test it out and because it might be on her side because it was working earlier, so.
My volume is as high as it
Members,
goes.
also, can you say something like an aloha?
My volume is as high as I can get it.
Yes. Or
Can you hear us?
can anybody
I
say
can hear you
something?
Okay,
All right, no, but we just need somebody to say aloha or hello. Because
I've
we
been
can't hear
saying lots
anything.
of stuff.
Not working.
Excuse me.
Oh, his mic is off.
Aloha, my kako. This is how Olito Moso. I can hear everybody clearly.
Actually, try
I can even hear the whispering. You guys are
Sorry,
whispering. I
folks.
can hear the whispers. Mahalo.
Now, yeah, now adjust the volume, go down or.
Can hear everything. Can hear
I don't know
everything.
if Chase or Tira, you can hear Monica. Okay.
I don't know.
Yes.
Can they hear me?
yes.
Okay,
we
so-
can now.
So it might just be at the office where they're at.
Well, let's go back to Monica. Could you say aloha for us and introduce yourself?
Well, I don't know. Can you hear me now?
Yes, thank you. Go ahead.
Well, I'm very excited to be part of Council on Aging. I'm Monica Rebella. I've been on Maui for 10 years. Prior to coming to Maui, I was on the Council on Aging in Orange County, California for 4.5, 5 years. And part of their structure was to include Medicare counseling, which is different than here on Maui. I do Medicare counseling here on Maui with Hawaii SHIP. So 2 different organizations all under the Executive Office on Aging. I'm alone now. My husband passed away 3.5 years ago, so I'm adjusting to a different life. Not a welcome different, but different. So I find this good. I'm happy to be involved in the community.
Oh, we're happy to have you here.
And I'm recovering from shoulder surgery. I'm still on do not drive. So I'm at home.
Okay, thank you and welcome. At this time, we'll open the floor to public testimony. Please be aware that all public testimony must be appropriate for the specific items on today's agenda. We'll ask each testifier to state their name for the record and which agenda item they are speaking. Each speaker will have a maximum of 3 minutes. And is there anyone from the public who would like to provide testimony? Seeing none, we'll close public testimony. Are there any objections? Without objection, public testimony is closed. Next item on the agenda is the approval of the minutes for May 12th, 2026. Is there any public testimony on that item? Hearing none, I'll close public testimony. Are there any objections? Public testimony is closed. Can I have a motion to approve the May 12th minutes, please?
I so move. I so move.
Thank you. And there's a second from Shane. Okay. Is there any discussion? Hearing none, all those in favor, aye.
Aye.
Any opposed? Thank you. Moving on to new business. We have a presentation from Ricky Melpor. Welcome, Ricky. Everyone received a bio, and it's very, very nice to meet you. The floor is yours, sir.
Good afternoon, everybody. Before I begin, I want to introduce my personal assistant to my left. His name is JR, and he will be assisting me with verbal cues and whatever else needs to assist me with. I just wanted to say I'm so grateful for the Council on Aging for inviting me to talk about blindness today. It has been a passion of mine to do public education in the community and within the state regarding blindness. And as you may or may not know, serving blind individuals here in Maui County is very limited, very, very limited. Many times blind individuals need to fly off to Oahu or to the mainland for training. And so my goal has always been to educate our people here on Maui regarding blindness and how we all can help blind people to live independently. Now, I want to start by explaining what blindness is all about. Number one, blindness is normally called where someone has 20/200 vision with correction. Perfect vision is what?
20/20.
Good. 20/200 is the legal definition of blindness. Or blindness can also be defined as a person with a visual field of 20 degrees or less. Normally, ophthalmologists, optometrists, eye doctors have some kind of a tool to measure in your eyes what your visual field is like. And let me use me as an example. I was diagnosed with retinitis pigmentosa, which the peripheral of your eyes closes in slowly until it comes to a pin point. So they kind of measure the field in that way. Many causes of visual disability or blindness. And then let me just say, I use the term blindness. I don't use visual disability. I don't use sight impaired, because part of my education is helping other blind individuals to move into accepting their blindness. Okay, so some of the major causes of blindness is macular degeneration. It's normally a generational eye disease, and it happens mainly in Caucasian families. The other type of blindness is glaucoma. Again, another generational eye disease, and it happens in every culture. My maternal grandmother had glaucoma. My auntie on the Big Island had glaucoma. My mom has glaucoma. My brother has glaucoma. So my mom and my brother are using eye drops to slow the progression down, not to cure it, but to slow it down. The other type of blindness is cataracts. Now, cataracts are usually black splotches that interfere with your vision. And in the year 2000, I had cataract eye surgery, and the surgery was successful. However, it made my vision worse. So sometimes surgery is not the answer. I have cataracts in my left eye, but I don't want to go there. And I choose not to go there because I want to use whatever vision I have left. The other type of blindness is diabetic retinopathy. And that's usually in many Asian Pacific Island cultures, and sometimes in Italian culture. And that's due to diabetes. So if I go to Tante's for lunch and I have loco moco, 2 scoops mac salad, side order French fries, what does my meal mainly consist of? Carbohydrates. And if I don't do my step aerobics or my Zumba in the afternoon, what happens to the carbohydrates? Turns to sugar. So I gotta watch out. And if I receive Meals on Wheels will definitely take your medical history. And what do you think my meal from Meals on Wheels will not contain? Carbs, correct. Or sweets. So we gotta watch. We gotta watch what we eat. Sometimes I am ono for French fries, like what we did today for lunch.
So good, huh?
It was so good. French fries with mustard and mayo. I couldn't resist it. So now this afternoon, I gotta go do my exercise to work it up. Okay. Sometimes blind individuals go through several stages. The first stage of blindness we go through is denial. We will say, I'm not blind, I just not can see. Or I'm not blind, I'm visually impaired. Okay, and as I said earlier, I like to use the real word blindness to help me move from denial to acceptance. Sometimes, if we are blind, we go through another stage called depression. For me, when I was diagnosed as being blind and having my driver's license taken away at the age of 18, that was a really traumatic time for me. And I went through 1 month's worth of depression. Some people, they take longer to go through that stage. But for me, I stayed in my room, locked my door. I didn't want to associate with any family members or friends or go out to functions or out in the community. I just stayed in my bedroom. And I wallowed in my pity, my self-pity about my blindness. Until one day, I opened my eyes and I slapped my face and I said, life goes on whether I'm blind or not. So I decided to get out of my room, get dressed, and go out to Kūpuna Center and just spend the day there walking around, trying to figure out what I have been missing. And what I was missing was the socialization part of what I needed to live. Many times blind individuals may have other disabilities, like mental retardation. And I use the term mental retardation based on the Diagnostic and Statistical Manual, 4th edition, published by the American Psychological Association. And as a trained counselor, we use that book. Now it's, I believe, a 5th edition that is out, but I still use the 4th edition in terms of me working with individuals when I do counseling. But I use the term mental retardation based on that. Other blind individuals may have other disabilities, like paraplegic, quadriplegic, or other disabilities. So the question is, how do we deal with those kinds of individuals who may have other disabilities aside from their blindness? Now, part of what I teach is based on the social model. Many times, agencies and people in the medical field will look at the medical model and focus in on the blind person's medical needs, like going to your appointments with the eye doctor, like, are you taking your eye drops? Are you taking your medications? Like, do you have grab bars in your bathroom? Do you have a bath chair? But who is really teaching independence to that blind person? Are you leaving the teaching of independence to other agencies? Or are you taking the responsibility to teach independence to the blind individual? Many times when I do counseling with blind individuals, I have a routine of taking an assessment from the minute the blind person wakes up to the time the blind person goes to bed. And I go through the whole routine of what they normally do at home or in the community and see what needs to be done to assist them if they need any help. So that's the social model. So I guess my question, not specifically to Rowena, but to the Office on Aging and to the Council on Aging, what are you doing to help teach independence to the blind individual? because as I said earlier, services for the blind in Maui County is very, very limited, next to none. The other thing I wanted to mention is the Council on Aging needs to look at the ADA law in order to help the Office on Aging and blind individuals in the community, because many times blind individuals in our community will come to you guys for assistance. So you guys need to figure out if the ADA law will assist them in any way. Many times I know Nani calls me and she kind of complains to me a lot about things that are happening to persons with disabilities and blind individuals in the community. But what I say is, well, let me back up a little bit. I know Nani is trying to do a symposium later on, sometime this year, about persons with disabilities, and she wants to have it at the Maui Beach Hotel. And she was asking me if Maui Beach Hotel would provide a ramp to go up to the stage. And many times the entity may not have a ramp. So they will provide reasonable accommodations to Nani and the disabled individuals who are going to be participating, and just put on long table on the floor with chairs. And wheelchair individuals will be able to go behind the table. And I know in Old Wailuku town, there are stairs into establishments, and a person in a wheelchair, as an example, may not be able to go into that establishment. So the entity will provide reasonable accommodations and may have that person, the disabled individual, go through the service entry to enter the establishment. For blind individuals, not too many blind individuals use guide dogs, but establishments such as restaurants and department stores need to make accommodations for blind individuals to use their guide dogs to enter their establishments. Taxi cabs. Oh, that's another scary individual. Sometimes when taxi cab drivers notice that a blind person has a guide dog, they're not going to pick up that blind person because of the guide dog. And so the question is, are they going against the ADA law? Sometimes yes, sometimes no. So I would suggest that the Council on Aging consult with the attorneys with the County of Maui just to see what their rights are, blind individuals' rights, and your rights are. Now, I wanted to talk about resources. There are resources out there, but do you trust the resources that you see online? Sometimes what you see online may not be what the agency is supposed to offer. So I would suggest if you have a blind client, a blind individual that needs services, contact the agency personally ask them what kinds of services they provide for blind individuals and where their training came from. And there are individuals who have been trained by the Helen Keller Institute. There are individuals who were trained by the Department of the Blind in Iowa. There are individuals who are trained in the Palo Alto area, and the blind school in Palo Alto is run by the Veterans Administration. And there are other resources out there in our community and the state, but you guys gotta check that out to see if they're credible or not. There is an entity on Oahu that provides assistive technology to blind individuals that may run up to $5,000 or more. But that agency does not mention to you guys or to the blind individual that you need to approach American Savings Bank and take out a loan to purchase the assistive technology. And at age 68, I don't want to take out another loan. I'm barely making it on my own right now. So part of what is lacking in our community is finances to help blind individuals to learn to live independently. Another thing that is lacking in our community is people teaching blind individuals to live independently. And a barrier to blind individuals in our community is also government. And I say government because governments sometimes don't know what to do with blind individuals. They'll refer you to other agencies in our community. Oh, go talk to so-and-so. Go talk to such and such. So sometimes government plays a vital part in creating barriers for blind individuals in our community. And many times, our own government tends to put a low priority on persons who are blind and other persons with disabilities. Now, one of the things that Angela put on the agenda was, how do you guys know what blindness is about? I do what is called Business of Being Blind. It's a 4.5-hour workshop that I do in the community that gives you guys a glimpse of what blindness is all about. And that's how you're gonna find out what is really needed to help blind individuals. And I've done several workshops like these on Maui and on the mainland with the Lions Club in California. And part of what is happening, the entities will really make an effort to try to send members of the agency staff people and board of directors to attend these training sessions so that they understand what blindness is really all about. As I said, it's a 4.5-hour training, which includes bento lunches, and some agencies have been creative. If they don't have enough funds in their budget to do the workshop, they'll be creative and charge a nominal fee for the bento lunch and a small honorarium of your choice. I don't tell you what to give you. Some agencies have been creative and collected donations from politicians and attorneys that support the blind community. There was one agency that collected funds and gave me a gift card for dinner for two at Tante's. So those are small suggestions that, you know, I give you guys further your education about blindness. Interesting. Good. Okay. I'll open it up for questions if you have any questions. And as the priest might say, speak now or forever hold your peace.
Mahalo, Ricky. Do we have any questions? So, let's go to Leland.
Thank you, Chair. Did anybody in the council want to ask questions first, though? I know I'm just a member of the public.
Okay, Father Tomoso, go ahead.
Oh, yes. Hi, Ricky. The idea here is, in my mind, I know that one time you were affiliated with and worked for, in various capacities, the Maui Center for Independent Living, MCIL. Is that center even here and statewide still in existence? And if not, what was supposed to have taken its place?
To be honest, Hawaii Centers for Independent Living dissolved several years ago. And I understand there is an entity out there that is replacing them, but I do not know in what capacity and what they actually do.
Because I would think that we would want to be involved with that agency and capacity to integrate it into the wider aging network if MCIL is no longer here. I'm just speaking kind of visionarily and strategically.
I think Rowena has some input to that.
So there is Aloha Independent Living, and they are statewide. They have an office, or they have a staff person here on Maui, and her name is Lihua Chang. And she has she meets with people regularly, or individuals regularly. She even holds support groups here in our office. We work with her to share resources, and they also have an office on Molokaʻi. On Lanai, Lehua flies. She doesn't fly. She takes the ferry and meets with individuals on Lanai. And one of the neat things is that she's collaborated with our staff person on Lanai, with Val at Lanai Kinaʻole, to assist individuals who are in need of services and support. And so that's the only center for independent living that we actively work together with. We also have a partnership with Nahoaloha, and Kathleen in their office also has a support group for individuals who are blind. I know she meets regularly with the team and has been able to provide support and serve as a like a community liaison and a offering guidance in accessing services within the community to those individuals who are blind and need support. So Naho Aloha is another organization, although Naho Aloha is not an independent living center. They do have somebody on staff who can provide that kind of support. Yeah, and that's as far as independent living centers. Yeah, that's Aloha Independent Living Center is the one that we work with. And a lot of these services for individuals who need training and like vocational or vision rehabilitation falls under a different category of funding under the Rehabilitation Act. So the Older Americans Act that establishes our office we provide support in terms of things like nutrition, like Meals on Wheels or congregate program, transportation, home delivered meals. I've looked into ways we can support things like vision rehabilitation, but it does fall under a different funding category, which it doesn't apply to our office. I know too that there may be opportunities where nonprofit groups can apply for county funding so that they can offer programs through county funded grants. But we've yet to have an applicant come in and provide a proposal for their services.
Leland, I'll come to you in just a minute. Honey, you had.
Yeah. Ricky, this is Nani. I definitely understand where Ricky is coming from. So Ricky and I both come from Centers for Independent Living Services. So basically, not having an John Tomoso, you're absolutely right, because you're very knowledgeable about independent living services. It was very critical that independent living services have a site. Because independent living services will service all disabilities. And, the Centers for Independent Living actually is a one-stop shop for individuals with disabilities that live independently in our communities. So there are groups out there that is living independently, once upon a time was part of Centers for Independent Living, but is no longer getting those services. So the CILs were actually that one-stop shop. And so anybody with any disability could go to the centers for services. But sadly, many of them shut down and there is no physical site. So the physical site makes a big difference, like for example, like Ricky. What I'm seeing that's missing in the community is exactly what he's saying, is education and training. So education and training is very vital today, because in the medical field, in our police department, how do you manage working or working with an individual with blindness, with deafness, a quadriplegic, a paraplegic? So there are still challenges out there where they're facing we don't know where to go. We don't have a one-stop shop, and who does the training? I have been involved with Ricky's training. Ricky, your training was called Business on Being Blind, correct?
Business of Being Blind, yes.
Yes. If anybody wants to learn, you don't have to go for 5 years of schooling, but you could do this 4 or 5 hour training, and you will get to the knowledge of how to manage a blind person. And I must say, on Maui, we're very limited with resources. We can save our money by utilizing our resources on Maui. So having an individual like Ricky teach on blindness would be better than me teaching blindness, because he is a wonderful trainer. So I totally agree on education and training, and you can come out of that understanding how to manage a blind person. So I was just on the Big Island with Vicky Kennedy, and she's blind, and she has a, what do you call it? Is it a companion dog?
Kind of.
A guide dog. She has a guide dog, and she was very impressed how I actually assisted her. And she said, "Oh, you are so good at it." And I says, "Well, do you know Ricky Melcher?" And she said, "Yes." And I said, "My training came from Ricky years ago." And Philip Anna was another blind person that was there, and also the training. So I know for a fact that individuals with those disabilities or any disability, training is really worth it. And thank you, Ricky, for sharing.
Okay, Leland, I am remiss for not calling for public testimony, so I'll come to you next. Could you, one, turn on your camera, and secondly, introduce yourself?
Sure. Okay. So, sorry, my camera's not working right now, but my name is Leland, just a member of the public. Ricky, you mentioned something about wanting to have more services about teaching individuals to live independently. One of the questions that I have for the council, because there are so limited mobility, orientation and mobility trainers, have you guys had the opportunity or have floated the idea of talking with the UH school systems to maybe develop a training or a partnership with the national orientation and mobility trainers to get that certification so that there can be a course, kind of like how this session they were trying to have the ASL coursework or training thing at UH so that you can do the same thing. And then there'll be more home trained individuals rather than just one. I know Kathleen Kenny, like you said, Rowena Nahoaloa is a certified orientation and mobility trainer, but they're so limited. And I think at Ho'opono at DVR, they had to go through that training too, but it's very expensive and you have to go off island to do so. So maybe having that conversation with UH, getting that course or that certification, being able to have UH offer that here on island, maybe at Maui Community College, then you guys can have those certified mobility trainers to be able to provide those services on Maui, because those are certified, cost a lot of money. And then outside of independent living skills training, that could be something else. So just a thought on that. And then I definitely know Nani likes the one-stop shop, and that would be great. I know Hano, the Hawaii Association for Nonprofit Organizations, definitely talked about having overhead costs is not feasible for a lot of nonprofits anymore. So actually having a roving model works out better for nonprofits, because having a physical building is just not sustainable for a lot of people anymore. So we're having to work through, different constraints, different having to be flexible in how we run things. And I think being a little bit more flexible on how we have to work together, and just making sure that even though you're saying that you don't hear about these things, like Rowena said, she's they're working with people. And she's been saying that like over and over again, but it just seems like there's some people that just kind of don't want to listen to what's out there. So I don't know. I think there just needs to be a little bit further communication, but I do think it would be interesting to float that UH national certification program out there. And I don't know if it needs to be law, but I think that might be worthwhile, Ricky, for you specifically, because that might be another way to help get more services that you're looking for and for your community.
Yeah, thank you. And I noticed that both Rowena and Angela were taking notes seriously. So I can assure you that your ideas will be incorporated to the plan. So great. Is there any other? John, go ahead.
Oh yeah, I just wanted to earlier. Nani, Ricky made a comment about your wanting to do another symposium. Is would that be an example of training, but also a way, a need for funding for that? Or is that already in the budget for somebody to do that symposium? Or what are we looking at in terms of moving forward with the symposium?
John, so we're talking with the Maui Wheelers, we're just grassroots group.
Yeah.
And so the symposium would be about individuals living with real life stories, where they were, where they are today. And because of the fact, and it will be done with a diverse disabilities and here on Maui. And we're doing the plans, we're looking at budget. We're looking at sponsorship to make it happen. Because the groups don't belong to any agencies. And so, but they thought this is coming from individuals themselves with disabilities, that having them share their real life story and having a symposium. And then hopefully after that, it would incorporate to education and training. So we're still working on that and we'll share that. Okay. Thank you.
Thank you. Thank you.
Can I interject on something?
Of course, go ahead.
I want to go back to what Lillian was talking about, approaching the University of Hawaii. That would be with the Centers on Disabilities. So that might be something that the Council on Aging might want to do as a project. For me to do that, I'm retired, I'm 68 years old. I'm
Oh,
done.
sir, I didn't mean you. I meant the council. I was just saying to your idea, I think the council should maybe think about that to address your issue, sir, not you.
Yeah.
Thank you.
I mean, I'd love to help in any way I can, but I'm not gonna do that all on my own.
Understood. Oh. Okay, well, this has been very, very interesting. Is there any other public testimony or any other questions from the council?
Please, no, please.
My name is Cora Bale Cox. But my question is, since there's a lot of intersection between disability and aging, I think it would behoove us to get the perspective from the Department of Disability, if we have one, and get a scope of what they provide. And then it might be an opportunity for us to partner with them on the efforts that they're already doing. And I have no clue in terms of what the disability department is doing. It might be beneficial for us to get that information.
Is there a county level?
So at the Department of Human Concerns, as the County Office on Aging, we operate the Aging and Disability Resource Center. Now, what we do is we can connect individuals with services that are available within the community or throughout the state. So if someone has a disability and has a specific need, then we have a resource, we'll identify a resource that we can make the referral to or help connect them to that resource. Because we don't have people on site who do the type of training that Ricky does. Now, let's say if Ricky was associated with a nonprofit group here and that they had the funding to support Ricky's program, then we would say, we understand that Maui Economic Opportunity at one point, they operated the Maui Independent Living Center and they have a great resource named Ricky Melpor. Let me get you the number, let me connect you to them right now. Right. And then they would get connected to Nani, and then Nani would be able to connect them with Ricky. So that's how it works. But right now, we don't have that kind of connection. Maui Economic Opportunity no longer operates the Maui Independent Living Center. At one point, they were funded through the County of Maui, but since Nani's retirement, it is no longer a service that's available. So we'll make referrals to Ho'oponopono. That's the organization that we would be referred to. The Division of Vocational Rehabilitation, that's a state agency. That's another agency that we would refer out to. Or we would refer them to the Aloha Independent Living Center. But as far as our the way we operate as a ADRC, we our contract is with the State Executive Office on Aging, and in our contract it states, okay, this is what you can do. You cannot use your funding for direct services to individuals.
So Chair, I wanted to piggyback on what she said. So definitely what's the gap that's missing the services from ages. Well, if you have individuals with disability in the school system, they're under the DOE. But then from, so like for Office on Aging, it's 60 years and older. So it's under 60. So you're looking at those that have graduated from high school. They're 18 years old. They come into the community. Now, what do the parents do with their adult child now going into the community? So it's like from 18 years and then up to 59 is where that gap of services is missing.
Okay. Noted. I think, yeah, she's taking notes furiously, so we'll try to address it. Okay, is there any other comments or questions? Sorry.
Yeah, Chair, actually, sorry, go ahead.
No, please.
Leland,
I
go
was
ahead.
gonna say, Chair, state level, I think Rowena and Cora may know this as well. At the state level, there's also the no wrong door, and that is also supposed to kind of act as a wraparound service thing where all of the entities are supposed to talk with each other and say, hey, this is what we do, this is how we can work together. DVR is also trying to do a Maui Disability Alliance, which is very similar to No Wrong Door, where all of the disability entities are supposed to talk with each other and say, hey, these are kind of what we do. How can we work together to make sure that all of our population is being served based on what we provide, make sure there's no duplication of services and stuff like that. So I think maybe Council on Aging, ADRC, the disability community, maybe can form something similar to like a No Wrong Door, a Maui Disability Alliance, where everybody has an idea of what kind of services everybody provides, what's the age requirements, if there are any age requirements, like centers don't have an age requirement, DVR does, seniors do. Like, what are the different restrictions for everybody? What are the different services? What are the exceptions, whatever, and then make sure that everybody knows everybody, and then just make sure that if they go in through one door, they can make sure that wherever you are, you can make sure that you can get help at any other location, and just be like, I know that you need help from this entity, I'm going to help you get to this entity, I know exactly who to get you connected with. I think that might help you guys out a lot. And I think that might be able to help you guys just connect better, because Maui's so tight knit, I feel. So I think if you guys just do that connection, I think it'll help a lot with you guys. Just I feel like you would be able to connect with each other a lot. And then like what Mr. Ricky said when he said that there's not a lot of services, or like people are trying to find like where they are. Do people know each other? So it could be like, hey, I know who this person is. Oh, I know Rowena here. I know Cora here. And you guys can just connect to each other that way.
Yeah, we are part of the No Wrong Door, and it's facilitated by the State Executive Office on Aging. In fact, we just had a meeting this morning with other partners. And so involved in the No Wrong Door are state agencies, the different Office on Aging in the different counties, and it's opened up to agencies that support children as well. So it's not just for older adults, but it does also involve all ages. So from child or birth till older adults. So there is a network that's available. It's just making sure that all of the agencies are participating and are on board. So if the Office on Aging in each of the counties are actively participating, but if the other agencies don't really buy into the concept, then it's not always going to work. So it really needs to be, there needs to be a lot of coordination, and somebody has to rein everybody together. It's not just a Maui thing either. We have a statewide network, and we have staff that participates in different task force meetings, focus groups. But when it comes to the No Wrong Door, it really does take a lot of coordination and facilitation to make sure that everybody's on board, using the right the tool for referrals and making sure that the communication's there.
Yeah, exactly. And I know it's a statewide thing too, but because you guys mentioned Maui specifically, I was just wondering maybe you guys want a Maui specific one. And I'm sorry to derail the conversation. I was just thinking about ways to better support Maui specifically, but thank you so much.
Yeah, all of that. Can you hit it?
I did. I just wanted to mention something. I'm King Van Nostrand, part of this council. We work very closely with our other nonprofits and AAAs across Maui County. We work closely with the Maui County Office on Aging that helps older adults 60 years of age or anyone living with a disability. We work closely with Aloha Independent Living to help any older adult or person with disability navigate Maui County services. In just support of the gentleman who's on the floor, we do have a support group that meets on the fourth Wednesday of every month over at MEO that supports visually impaired individuals in Maui County. We have no age limit. I think we have somewhere around 20 individuals, but work closely with other organizations on how to navigate the world of people that are visually impaired. So there are resources available, and we also operate under the framework of No Wrong Door, and that's just not saying there's a door, go open it up. It's going to the door, opening up, and help them get through the door and to navigate other organizations. So just to let you know that there is a support group once a month at MEO. It's 12 o'clock to 1:30. And we also offer rides to the support group. MEO is a partner with us, and they pick up people in Kihei. We have volunteer drivers in Central and Upcountry Maui that will help bring people to this meeting. So there are options.
Looking at you, King, I was just reminded, the public health nurses, they also facilitate a group with different providers such as Napo Aloha, Halimapua, and Rosalani Place, and all different Kūpuna and disability organizations. We all meet once a month, and it's like a what do we call it? Kūpuna Community Partners. So it's kind of, how do we operate? I can't think of the word right now, but it's but we review different cases that pop up in the community. IDT, interdisciplinary team. I have so many acronyms in my head, I can't get it straight. So interdisciplinary team, that way, once a month we meet, the staff will talk about different cases. They won't identify the names of the individual to maintain privacy and HIPAA. But if there's an agency that's working with an individual with specific need, then they'll share it with the IDT members, and then they work together to brainstorm and come up with different solutions for that individual. And oftentimes public health nurses will then say, okay, we'd like to know more information and schedule it.
This is Nani, Ricky. I just wanted to share that I know that there's a lot of support groups or meetings going on, But for the deaf community or even our Maui Wheelers, they have no idea what's out there because they don't belong to any agencies. Many of these individuals need to be invited, and like I said, they don't have an agency that they belong to. They're very independent. Many of the deaf will tell me the barrier is, they're afraid. They ask and they say, oh, we don't have an interpreter. So the barriers are either they don't have a ride or they can't get an interpreter. And so that seems to be the biggest barrier for the deaf community. And so honestly, the deaf community just give up because the barrier to communication should no longer be a barrier. No matter what you have going on in the community that is open to the public should have reasonable accommodations. But it seems like they'll always say, are they going to have an interpreter? And I said, oh, I don't know. So that is why many of the deaf, and they are aging. And that's why many of the deaf are not involved in many of these things that's happening in the community, or even like the Maui Wheelers, because Maui Wheelers are spinal and neurological support group. They can't be up there at 8 o'clock because of their care level. Yes, so anything after 9 o'clock, so, and I know in the past that they have mentioned this many times, but nobody has, even for a county council meeting, if they wanted to go and testify, they can't because of the time difference. And there has never been any changes for reasonable accommodations. And another thing is many of them don't go online. They're not they don't have computers. So they basically, get calls, they get, a mail, or if I see a flyer, because I'm involved in all the groups, but I share the flyer and that's how they're able to know what's going on. So basically they're not, they don't know what's going on in the community. And many of them are very active. Yeah.
That's the same way with blind individuals in the community. It's not accessible to meetings or groups because there's no large print, there's no braille, there's no reasonable accommodations to fit their needs. Or sometimes they're ashamed or afraid to ask for reasonable accommodations too. And that's part of the culture here in Hawaii. A lot of the Asian blind individuals have been taught not to speak out, because if you speak out, you're causing trouble. So if they don't speak out and ask for large print or in braille format, sometimes when meetings occur.
And I just wanted to comment on that too, and thank you, Ricky. And it seems like the accommodations for these groups become a large barrier. It's either going to be funding or finding communication access. So that seems to be one of the barriers. Is accessibility, right, Ricky? And it seems like making large prints, braille. I was just at a meeting, they had braille there printed. And I think Maui were small enough to know who would be attending to make it reasonable accommodations. But it seems to be that the cost to find an interpreter, who's going to do all the braille if it's needed. So I'm trying to hopefully look as inclusion to be not a barrier, but to include we must remember that there's blind people out there and there's deaf individuals out there that might want to be part of. But I think in the disability community, the comments should be coming from individuals like Ricky himself versus me making a lot of the decisions. And I think that's missing. Thank you.
Mahalo, everybody. And Ricky, mahalo. I have to say, your presentation and the discussion around it is probably one of the longest we've had. So not that that's bad. It indicates the real interest in the topic. So mahalo, you're welcome to stay. We've got other issues, of course, that we're going to go over. Mahalo again.
Hello, everybody.
Thank you, Ricky.
Thank you. Thank you.
Okay, we'll move on next to unfinished business. And that's our discussion on council size. I'll open the floor for public testimony. Is there anyone who would like to give public testimony? Right, I'll close public testimony without objection. Hearing none, public testimony is closed. Last month, we tabled a motion to reduce council size pending further research. Rowena and the staff have done that research, and Rowena has presented us with a letter discussing that. So I'd like to invite Rowena to summarize and open the discussion.
Yeah, I didn't want to read the whole letter because I think this is like 5 pages long. But what we did was we researched the need for 15 members and also some of the issues that we've had in the difficulties in achieving quorum. And what we noticed is that, in the past 2 years, we had an issue with obtaining a full board. So we were operating with just 10 and sometimes even 9 members, but we still needed to meet the 8 needed for quorum. So it didn't matter whether or not you had 15 members and then you have 8 for quorum, or 10 members and then you drop it down to 5 or 6. You still needed 8 people. So if you had 10 members, you still need 8 people. So that's why we had a difficult time achieving quorum. Also, 2 years ago, we only had meetings every other month. So when the Cost of Government Commission had their report saying, the commission only met 4 times. That's actually pretty good because you only had 6 meetings that were scheduled. Now we changed it so that you're meeting every month and that the content becomes, stays with you as opposed to, you losing interest after a month and a half. So I think that also helped with the quorum issues. The other is making sure that our members, we have full membership. That's helped within the last 3 months, I think, because you've been able to meet ever since we've had a full 15-member board. So I think we're on the right track when it comes to, having 15 members on the board. I think 15 members also opens up for more representation on the council. Like right now, we have Auntie Valerie from HANA and also Councilmember Shane Sinensi. Although Councilmember Shane Sinensi, it's a requirement to have a council member, an elected official on board. He also represents HANA, and we have Lehua, who also represents HANA. So we're getting good representation. And in addition to Lanai and Molokaʻi, at one point we had 2 members from Lanai up until Auntie Helen had passed away and her term ended. And we also have good representation on the ages on the commission. I'm assuming Chase, you're the youngest on the commission. But we have really good representation. I think we're also meeting the requirements of the Older Americans Act, because we have different sectors represented, not just consumers of the services, but we have providers who are represented, Naho Aloha King, and then with you, Chair, from Halemakua. So that's and then in the report, I also made mention of or highlighted parts of the Older Americans Act, the federal regulations, and also the county requirements on the size of the council. I also mentioned about the memo that was issued back in January of 2025 regarding the attendance policy. I think that's also helpful because right now what Angela and I are doing is that every quarter we're going to be looking at the membership, and based on the attendance, we'll send a letter to the mayor's office announcing the some of the issues that we've been having with the attendance of certain members. But I think my recommendation is to keep the size at 15 based on some of the improvements that we've made over the past year. But again, it's really a recommendation, just a recommendation, and you have the opportunity to look over the recommendation and then also create your recommendation to the mayor as well.
So I'll open it to the board for any comments or questions.
Is there, like if you're absent, what do you call that? And if you're absent so many times?
Yes, there is.
Oh, there is?
She was saying you do an audit every quarter, right? Yeah, and we have written into the bylaws, I think.
It's the attendance
Okay.
policy.
Oh, the attendance policy.
The attendance.
Yeah. Go ahead, sir.
I also want to mention that Angela is very attentive to our mission, okay? She's really on top of it. The docs are always on time.
Yeah.
She also works with the RSVP program, which is kind of counting her chickens before we get together. So I'm sure that she could see if she only has 4 RSVPs for a meeting, that she can alert people that, hey, I need you to show up for this next meeting, or, I think we're doing all right. So I think having Angela on board has really helped us keep a quorum, okay? And I think it's a good momentum going forward.
I agree. I think both Rowena and Angela have done an outstanding job. While I've been involved, I think we've seen, the quality and the quantity, but the quality of the meetings really improved. And I think that's down to you guys. We're along for the ride. You guys drive.
Right.
So I really want to commend you. Any other comments? Okay. So I think, was there a hand? I didn't see.
Thank you. Just for clarification, Chair.
Yes, go ahead.
So Rowena's, and my apologies, I haven't seen the letter, but Rowena's report was to retain the 15 members recommendation.
That was the bottom line, at least in my read.
Okay, yeah, and remind me again, if we did, and I'm in total support. I think our meetings and quorum has been great lately, and I do agree we do have more representation from all 3 islands. Remind me if we did change it, what would that entail? Would that entail just ordinance or something?
Should we ask David to comment? David's our counsel, right?
Yeah, Chris.
Oh, sorry, Chris.
Akakū.
Oh, Chris, sorry. Hey, Chris.
Hello.
So Shane, would you restate your question?
Mahalo, Mr. Nunokawa. We were discussing the if we wanted to change the amount of members on the board, what would that entail?
I believe that you folks are a code created.
We're getting nods on this side.
So We would need
So-
like a,
So
Go ahead.
if that's the case, then it would just be a code amendment to change the membership, and potentially I'd have to go and check whether there's any admin rules that would need to be updated at the same time. But that should be all that would be required for you folks to change the amount.
okay. Thank you for that explanation. Thank you, Chair.
Certainly. So I think if I may, with the council's permission, summarize the bottom line of your recommendation, Rowena, is that we do not change the council size.
That would be my recommendation.
Yeah.
Only because the issues that we've had in achieving quorum has been our ability to recruit and retain active members, making sure that attendance patterns are monitored and documented and reported. And then also based on the makeup of the board, we have greater community representation
For sure.
when you have 15 members. And then you also allow for very active discussions as well. So that's really helpful to me and the rest of my staff as we prepare for programs within our office.
Okay, so the suggestion from the staff is that we maintain the current membership requirement or number of members, and that we permanently table the motion. Is there any objection to permanently tabling the motion? Hearing none, the motion is tabled. Thank you.
But I do have to say, you guys are great. And I feel very lucky because when I was on Oahu last week, attending the policy board on elder affairs, it was there. The Big Island doesn't even have a council on aging. So there's no active council at the moment, and that's a requirement under the Older Americans Act. But I shared information about the types of discussions that you've been having, and then also recommended to the PABIA board members that they should share legislation that they're supporting with all of the different councils on aging, so that everybody's connected in supporting legislation or promoting initiatives, just like the one that we talked about today about contacting the University of Hawaii and seeing if there's support for establishing training within the state. It's not just the Maui County thing, it's a statewide thing. And if we could get legislation to enacted to provide funding for these training opportunities, I think that's something that you guys could initiate with the support of PABIA and the other councils on aging as well. And I see a thumbs up from John Tomoso because he's very active with the legislative committee, PABIA.
Okay, so mahalo. Without objection, we'll move on to regional updates. Are there any members of the public who would like to testify? Seeing none, let's move on to HANA. Is there someone who'd like to present the HANA? Okay.
I was trying to get an update from Halihulumamu, but I did not receive one. But if there are in Lehua, I don't see Valerie. So I can defer to the other communities. Thank you, Chair.
Okay, mahalo. And we're always happy to receive the report midstream. So if you have something to share with us, please do so. How about Molokaʻi? No?
He's here,
Okay,
but
all right.
We do have a Molokaʻi fair that we're coordinating with our staff member. So that's happening on mid-August. Gotta look at my calendar. August 14th from 9 a.m. to 1 p.m. at Mitchell Pa'ole. That's a Friday. And we're working on securing our guest speaker. And in fact, I just spoke with Jenny Worth over at Pacific Cancer Foundation, and they are partnering up with AARP and our office to have a series of workshops on home safety. So there's a speaker who can talk about making, how to make your home accessible and safe with grab bars, lights, and other things. So we're working on securing them as a speaker for the Molokaʻi Senior Fair, as well as our annual Senior Fair in November. So yeah, August 14, 2026, Mitchell Pa'ole from 9 a.m. to 1 p.m. for the Molokaʻi Fair.
Okay, thank you. And then from the Lanai, no updates. Okay, hearing none, we will move on. Oh, okay. I don't know if you heard that, but Pineapple Fest is coming up. Okay. We're moving on now to item 7B, which is the 4-year plan on aging. Rowena, could you provide an update?
I'm going to ask Karen if she can put up the slideshow presentation. And this is something that we talked about last month. I gave you an overview of our area plan, our goals, the mission and vision. So let's go to the next slide, Karen. And so I'll ask Angela to make it available on our website. I think it's already on our website, but I just wanted to run through this again. And we can go on to the next slide. Purpose of the plan. And then let's go to the next one. Let's go through the next 5 slides. Oh, stop right there. Go back. Area plan goals. Back. There you go. Okay, so we have 4 goals, and those 4 goals were established with the other area agencies on aging, Big Island or Hawaii Island, Honolulu City and County of Honolulu, and Hawaii County, as well as the State Executive Office on Aging. So 4 topics. The first topic being Older Americans Act for programs. And the goal is that Hawaii's older adults have the opportunity to live well with services that promote independence and connection. The second topic area is greatest social and economic need. Hawaii's most vulnerable adults can access the supports they need to thrive. And it falls in line with the discussion that we had today with Ricky. So the third one, expand home and community-based services. Hawaii's Kūpuna can age safely and comfortably in their homes and communities. And the fourth one being support family caregivers. That Hawaii's family caregivers are supported, valued, and able to sustain care for their loved ones. Let's go on to the next slide. And just a reminder, our priority populations are low-income older adults, rural and neighbor island residents, individuals with disabilities, Native Hawaiian Kūpuna, individuals with limited English proficiency, and homebound and socially isolated older adults. Okay. And let's go on to the next slide. The areas that key needs that were identified in this current plan through our surveys and discussions with providers and individuals was affordable and accessible housing rose to the top as one of the biggest needs. And I think this also came right after the Lahaina and Kula wildfires. Transportation and mobility support was a key need that was identified in the plan. Food security and nutrition services, caregiver respite and emotional support for caregivers is also a big need We see a lot of caregivers in different stages of their lives, some as young as 14 years old. We have grandchildren helping their grandparents who raised them. And now they're in a situation where they have to help their grandparent who's aging, to a loved one who is in her 80s taking care of her husband who's also in his 80s. So caregivers can be of all ages. Social isolation and mental wellness is another key need that was identified in the last plan. And of course, emergency preparedness and disaster resilience. We anticipate that these needs will also continue on into our 2027 to 2031 plan. Okay, we can go into the next slide. Service priorities are aging disability resource centers, case management and options counseling, home delivered meals and congregate nutrition, transportation services, caregiver support, and also continuing evidence-based health promotion and fall prevention.
Sorry about that. Quick question. Do you guys have, I know there's a person taking care of her mom and trying to get like caregiver support, but it has to do with their income and house. So do you guys help with that?
We can assist because our services are not, we don't go by income. And we go by the needs, so we identify the number of ADLs and IDLs, activities that they do. Okay. Medicaid, however, that's going to be that's based on income. And our services, because we get limited funding or that our funding is constrained, we can't provide like 5 days a week or 7 days a week of service, unfortunately. So we have to be very strategic in how we can help everybody.
Yeah, the question was because the mom's name is on the house. So does, and so they were questioning about that might be a barrier from the mom getting.
That wouldn't be a barrier for our.
Oh, yeah. Thanks.
And then let me skip on to a few. I want to go to the next one, Karen, because I went through this last one. Okay, go to the next one. Challenges and opportunities. Next one, the funding consideration. So whenever we do our 4-year plan, we also take into consideration uncertainties at the federal and state level when it comes to funding. Continued reliance on Older Americans Act funding becomes a concern for us because we don't know what administrations or Congress is going to do with the Older Americans Act. So we need to find ways to diversify our funding sources. We rely on Kūpuna care at the state level and county to also invest in our services or services for Kūpuna. There's an importance or a need to establish partnerships and seek grant opportunities, but oftentimes seeking grant opportunities and monitoring grants can take a toll on an organization as well. And then, meanwhile, while we're looking at our existing funding, like what I said earlier, our focus is on being able to maximize, using the funding to maximize just direct services to residents. Okay, next slide. We have our community input process that's coming up. So it includes community surveys and listening sessions. We're going to rely on you on the Council on Aging to provide feedback, getting input from caregivers and Kūpuna. We're looking at our data because we record all of our calls, meaning that we take data on all of our calls, assessments and program reports. And there's also continued coordination with the State Executive Office on Aging and our community partners. So going to the next slide.
Wait, before you do that, going up to the very top one, the listening sessions.
Yes.
Are they open to the public, and can you let the council know
Absolutely.
so that we can attend or at
Yes.
least get feedback? Yeah.
So we encourage people to, or, members of the public to also participate in Council on Aging meetings, because this is also part of the listening session, getting feedback and input. I was talking with David Nakama from our office, so we're going to be scheduling listening sessions in the various communities, starting with our congregate program participants, and then also reaching out to providers and other agencies. So later, after the presentation, I'd like to get some input from all of you as to who we should reach out to, or suggestions for who we should reach out to. So with the community surveys, let's go on to the next slide. And I want you to take your phones out, because I'm going to do a little technology lesson with everyone here. And this is...
We got two IT guys right
Yes.
here, but okay, go ahead.
Awesome. So this is our community QR code. It's a link to our community service link. And it's entitled the Hawaii State Executive Office on Aging and County Offices on Aging, Understanding the Needs of Older Adults in Hawaii. There's a link to the Survey Monkey as well as the QR code. And this survey will help us understand the main needs and challenges that older adults face, learn about the experiences of caregivers, improve access to services and support, identify gaps and barriers in the community, and plan better programs and services for the future. So participation is voluntary and anonymous. We will not collect email addresses. There are opportunities like open-ended questions for survey respondents to provide feedback. And so if you're not familiar with how to access a QR code, what you do is you take your phone and you open up the camera app and zoom in to the QR code. And when you zoom in, it'll pop up the link. So on my phone, I see a yellow bar that says Survey Monkey. So I tap onto the link and it'll open up the survey. And you know what's another cool feature on your phone? If you have an iPhone, you can click on the little box with the arrow, and from there you can add that as a bookmark to your to your web browser.
You can also send it to yourself in email, or send it to somebody else in email.
This is good, because I think even for like individuals with disability, they all have phones
For sure,
and they like QR codes.
Yeah,
for sure.
and there's like a lot of great accessibility
Yeah.
features. Also, when you click on that arrow with the box, if you scroll up a little bit, it says there's a feature here that says Add to Home Screen. So it'll create like a little app on your phone. So let me see if I can pull up. I don't know if I can share that with everyone, but where am I? Oh, I can't really share right here. I don't know if you can see it, but there's a little arrow and you click here. And then if you scroll up at the very bottom, there's a feature or a something in there that says Add to Home Screen. If you click on Add, it'll create a little app on your phone.
Thank you for calling technical support.
So please take some time to complete that. We're going to be sending out a press release by the end of the week to have it out to the public. And this is a statewide survey, and but we also collect data on the zip codes and the counties. So there are questions in there that respondents can say, I'm from Maui, or I'm from Akakū, this is my zip code. And then what we do is we filter out the responses. Yeah.
So is this a needs assessment?
It's a needs assessment.
Okay, so that's thing.
And then
Is there questions, and I haven't opened it yet, but are there questions relating to disability too? Because we talked about the intersection between aging and a lot of disability, because that might flesh some of those information.
that's a really good question. It's when I looked at the survey, keep in mind that this was created at the state level.
Sure.
So there aren't very many questions relating to disabilities, but when we have our listening groups, our focus sessions, there are a number of questions that talk about disabilities. Like we're asking, do you have a disability that prevents you from accessing services in our community? And then the follow-up question is, what are the barriers? And so we do have that as part of our Maui County specific survey. So that's the link to our community survey. The next slide is information about our systems and provider survey link. And this will be a survey that's provided to policymakers. So it's going to be sent to our county council members, state senate, state house representatives, elected officials, and community organizations, as well as network providers such as Aloha and Halemaha'olu, Halemakua, to better understand system level challenges and service gaps. There's questions in here about workforce capacity and the challenges of funding constraints and suggestions for system improvements. So this is another survey that will help us identify the systemic barriers in delivering services. Again, understanding workforce capacity challenges, assessing funding and policy limitations, where the unmet needs are in accordance with the observations made by these organizations, and also gathering recommendations for better coordination among network providers. So yes, there's going to be two different surveys. It's a community survey, and then the other is more geared towards policymakers, network providers, and community organizations. And going to the next slide, this is just a reminder of what our timeline looks like. So we are in phase 1, where we're scheduling community sessions and focus groups and collecting data through our surveys. We intend to hopefully be completed with all of this by the end of September, and at that time be able to finalize and look at our community data so that we can go into phase 2, which would involve drafting the area plan on aging and coming up with different objectives, strategies, and outcomes, basically our performance measures for the 4-year plan. Our target date in being able to conduct public hearings with our Council on Aging is April 30th, and submitting our area plan by June 30th, 2027 to the state office. And that's about it for now.
Okay.
So I guess one of the first steps is to have the Council on Aging complete the survey. If you are, you can go ahead and share it now that you have the link on your phone and you have the QR code. We will, again, like I stated, be sending out a press release so that we can get greater participation in the community, and then hold listening sessions after that. But I did want to get some feedback as to who, community groups that we should schedule meetings with, or providers or organizations that we should invite to upcoming meetings or listening sessions. Sorry.
That's what this survey is. It's not prioritization.
No, it's a different.
That one is for this meeting
I see.
going forward.
I see.
So before we open it to the council, is there any public testimony? Hearing none, we'll close public testimony now. Why don't you restate your question?
I just wanted some feedback as to who we should contact to reach out to for a listening session, or even to distribute the surveys.
Okay. Any questions or Suggestions? John?
Yeah, reaching out to our communities of faith, both ecumenically and interfaith wise. I think there is a lot of aging happening in our faith community, present company included. So I think that always communities of faith are, or faith communities, ecumenically, interfaith, broad brush is important to aging because they themselves are aging. As society ages, so do the churches, synagogues, temples, and ashrams. Yeah. And there are at least 3 clergy associations that I'm associated with that could help with that, get the word out.
We will be in touch with you.
I'm sorry, what?
We'd like to get in touch with you to
Yeah. Okay.
connect. Yeah.
Yeah, because I know it's important. Yes, thank you.
Other suggestions or comments? Hey, go ahead.
I have a comment in terms of the area plan. So question, the community needs assessment that we're going to do with the QR code, that could potentially, the outcome of that could potentially change the needs assessment that you've already identified in your plan, right?
It could. It could.
Okay, it could, but almost always it seems to be trending the same.
Yeah.
Yeah, kind of general. So, and the second question is that how are we going to measure effectiveness? Because I didn't see measures.
Yes.
Yeah.
So in the area plan, there are specific measures for the different goals and objectives. Just to give you an example, one of our goals was targeted towards our enhanced fitness program and measuring the just participation in the program and establishing new classes in the different districts. That's one area that we haven't been able to meet yet because our goal was to get out to Molokaʻi and Lanai and Hana and have an instructor and a location there, but we just haven't been able to do that. So that's one that we're measuring. Our partnership with Maui Emergency Management was one that we had in there. Another one was regarding nutrition services. So there are measures in the plan, and I can give you an update at next month's meeting.
And partly because you mentioned with the scarce resources, a lot of uncertainty with funding and things like that. I think it's important that any goals that we set, we need to have some form of measurement in order to provide that information to those people who are going to give us funding.
Yes.
Okay, thank you. Any other questions or comments? Okay, thank you, Rowena.
Thank you.
Without objection, we'll move on to the county executive report. Rowena?
Oh, I'm sorry, Kalamai. Lately, and this is something I want to say publicly. It doesn't have to be recorded, but to all of my colleagues here. What I see right now is almost, what is the word? What is the descriptive? There is a fundamental shift in relationship with government at the federal level. That especially, I think, in a state like Hawaii, which is very isolated and kind of more on the liberal side rather than the conservative reactionary side. The shift is that, we have been spoiled in this jurisdiction. We've had a lot of pork, if you want to call it that, and fiscal relationships with the federal government that are inexorably gone and changing. The challenge then is to sustain ourselves without that level of federal, at least fiscal participation, and I would say even in terms of policy participation, because the politics in this country is wacky right now. And I think the challenge for all of us in this very liberal, inclusive, hey, we're a DEI state. I grew up with DEI. I'm DEI. You know, a lot of us here are DEI people. We grew up with that, and here we are culturally being challenged. We're culturally being challenged as to who we are, why we are, and how we are. And I think for all sectors, the aging network and aging notwithstanding, we have to know that our relationship to the federal government is changed. I'm going to be that bold in saying that. And so I think that is something moving forward that we have to include not only in our planning and policy discussions, but also in the way we conduct ourselves. In fact, I just finished this survey. I just did it, Rowena. I went, boom, I did it. And I said, you know, the sense of community, the sense of belonging is going to affect me. You know, I mean, interesting enough, I grew up on Maui when Maui only had, Ed, you know, we only had 30,000 people. Everybody knew everybody. By the time I got home, my mom and dad knew everything that happened. And they would tell me, so what happened? And I go, what do you mean? You better say the truth because we already know what happened. You know, all those intimate, imminent days of personality and personhood and community and belonging are fast eroding. And it parallels the erosion, I think, of our, since 1959, what was 1959 statehood? I remember it. Our relationship with the federal government, it is changing, brothers and sisters, and that is a challenge. That is a challenge for me. I'm quite sure it is for you. It is for you as well. I'm done.
Okay. Okay, so, here are we at the executive report? Go ahead.
Okay, so you have, well, I will get this to you.
Okay.
So highlights just that the second reading of our fiscal year 2027 budget was held on Friday, 5th. We want to thank the County Council for supporting our budget, including our additional request of $1.3 million to the general fund for home and community-based services. And this gives us a total of $2.5 million that we can use towards services in our community. And what we've seen is stagnant funding at the state and the federal level. And like I've mentioned in many of our meetings, when you have stagnant funding, it actually equates to a decrease in funding because the cost of services just keep rising every year. So we're really fortunate that our council, county council, with Councilmember Shane Senensi is very supportive of the programs for Kūpuna, including supporting the grant subsidy programs for organizations such as Habitat for Humanity, where they do safety repairs for disabled and elderly low-income homeowners, Haleʻʻolu's personal care program, their subsidy program. This year, Haleʻʻolu also added a new mobile meals program to address the nutrition needs of adults who do not qualify or are eligible for our services. So this involves individuals who are disabled under the age of 60 who would benefit from home delivered meals. Haleʻʻolu Health Services is establishing a home health program on Molokaʻi. So the council approved the appropriation for their program in the amount of $200,000 to get established. Lanai Kino'ole saw an increase in their grant program as well, so that they can continue to provide home health services. Maui Adult Daycare also saw a small increase in their county budget. so that they can provide services on on Maui, Central Maui, South Maui, and in Hana. And then also the Molokaʻi Rural Health Association for the Molokaʻi Kūpuna program also is supported in this year's fiscal year 27 budget. Another addition to the county grant subsidy program is Naholoha's on-demand transportation program, so that we can increase the number of transportation opportunities for older adults and individuals with disabilities. So lots of great grant programs are ahead. Our program specialists are going to be very busy next year monitoring these grants. I also shared information about Molokaʻi Rural Health, their fiscal year 26 grant that was executed on April 23rd. I just had a meeting with them yesterday to go over the grant, the expectations of reporting and or quarterly reporting, and what kinds of supporting documents they need when they request funding every quarter. We're also I've also sent a grant agreement for Halehulu Mamo Senior Center out in Hana to Corporation Council for their review. So we're hoping that this moves forward by the end of the month. And I also wanted to announce that we received some additional funding from State Executive Office on Aging in the amount of $160,697 for our ADRC operations. In fiscal year 25, we saw only $54,000. So this year, this fiscal year 26, they appropriated $160,000 to the ADRC program. In the report, I also note the staffing report, our vacancies, and a lot of these positions are vacant because of reductions in funding. Workload capacity issues because of staff vacancies combined with the transition to a new database system. This continues to impact our capacity to complete assessments on time for new program participants. But we're working through that backlog by offering overtime to employees. So as far as public complaints and compliments, we do a survey that gets sent to our office by participants of our program. One of them had said that a lot of them indicated that they're satisfied with the services that they received. One respondent did indicate the need for more caregiver help. Another highlight is our data. So in the report, I showed the number of clients that are being assisted in the different service types and the amount of the service. So in April 2026, our total cost was $177,000 for all of the different services. This doesn't even include Kaunoa Senior Center, their home delivered meals program that services, I think, about 700 people. We have some issues with our new data system when it comes to data collection for Kaunoa Senior Center, so those numbers are not there. Going to the next page shows you the call volume that we received. We had 481 outgoing calls and 481 incoming calls. And then the number of emails that we addressed in April 2026 was 81. Or outgoing emails was 81, 79 emails went out. We did 40 home visits, took in 25 walk-ins, addressed 24 inquiries through the mail. Our service specialists are also assigned cell phones, so we even recorded the number of text messages that they've received from participants. We have a website where members of the public can fill out a form to ask about services. So there were 7 collected. That's something that we're going to need to increase, or we're going to look more about into that so that people know that we have a website available. Yeah. And text messages that came into our office was 5. I will skip to the rest at the end. I wanted to share miscellaneous, item number 10. So in the past month, we've encountered several situations involving vulnerable Kūpuna who are unexpectedly displaced when a family member or caregiver is arrested, incarcerated, or if they're involved in a abusive situation. So an example of this is last week we had a call where we had police officers come to our office first thing in the morning and ask, we have a senior who we brought to the hospital. They were displaced from their home. We didn't know where they could go because it looked like they have dementia. So we brought them to the hospital. Is there anywhere that they could go? And, we usually refer to agencies such as Kahale Keola or Women Helping Women. But there were some issues with the intake and limited capacity. So it begs the question, are there other resources available within our communities, not just Maui Island, but Molokaʻi, Lanai, and of course in Hana as well, when situations like this occur. So our program specialists will be working with Maui Police Department, APS, and other entities, including prosecutor's office, just to identify gaps and come up with potential short-term sheltering solutions and emergency respite solutions. I've also talked with my director, Maggie Willis, who you met a couple months ago. So she's interested in this topic as well. So this is something that I'm hoping that we can provide an update on in the next couple months. I also wanted to congratulate. Yeah, go ahead.
Let me interrupt. I want to acknowledge that it's 2:31. I appreciate your time. If you need to leave us, go ahead. We'll miss you, but go ahead.
No, and then finally, congratulations to Carrie Valdez in our office. We nominated her for a national award presented by Mom's Meals and U.S. Aging. It's the 2026 Community Champion Award. So this national award is presented annually at the U.S. Aging Conference in July, and it recognizes case managers who demonstrate exceptional commitment to improving health and well-being by connecting individuals with nutrition and other essential services in our community. So, Carrie plays a very vital role in our office by connecting Kūpuna with services and supports. She's also refereed some family issues as well and has provided lots of service in our with our older adults. She's been with the Office on Aging for over 30 years. She's also in her 70s. And even with all the technology changes, she hangs in there and she just plows through. So we're very happy to announce that she was notified last week of winning the award. She gets a complimentary conference registration to the U.S. Aging Conference in San Diego in July, along with 2 nights of hotel accommodations and travel to San Diego.
Very cool.
So congratulations.
Well done.
And that's it.
Okay. Wow. Thank you. Is there any public testimony? Hearing none, do the council members have any questions or comments? Okay, hearing none, we will move on. Sorry, John, go ahead.
Wow, I'm so old. I remember Carrie very well. I'm really old, but the idea here is that's marvelous. I mean, in all of the aging network, even statewide, I dare to say this: Carrie is a star, and she's an enduring star. In fact, when I was at the luncheon, I said, "Hi, Carrie, you never retire yet." Oh my gosh! Wow. Yeah, so I just want to say, could you let Carrie know that I'm so happy for her and for us, actually, because that's just an example I think, of the quality and the tenure and the stick-to-itiveness of staffing here at the Maui County Office on Aging and Disability Resource Center. Thank you.
Thank you.
Thank you. Okay, we'll move on to agenda setting for the next meeting, and I'll put a plural on that. Is there any public testimony? Hearing none, I'll open it to the council. I want to remind you that there was a survey. We asked the survey or the staff to prepare a survey. That's in front of you, and you should have it in your packet for those of you that are online. Rowena, do you want to talk about the survey? Oh, and would you like to talk about the survey?
Sure. This is a very simple survey based on the topics that the council has shared with us that they are interested in. This survey will help us prioritize when we're scheduling our meetings. There are so many to choose from, so this will kind of just help us gauge the council's interest. There are kind of some duplicate items on there as well. There's also an opportunity for you to share. We do have new members who were not able to provide previous responses for additional topics, so new members are also considered in this survey.
Okay, so
we don't have a quorum at the moment. I think
Okay.
we lost it when
Right.
the Rebella left, so I don't know if we can vote on distributing this.
okay, all right. But why don't we table that for next month? And since we're tabling it informally, if you've reviewed this, are there any other issues that you'd like to or any other suggestions that you'd like to add? I know I'm catching you off guard, so you might want to send Angela and Rowena an email suggesting other topics. The one that I'd like to surface and sort of get a flinch test from all of you, we're having a mayor election at the end of this year. I'm wondering if, as we narrow it down to the two candidates, if it would be worthwhile to have the candidates come and make a presentation to us. I'm getting one yes. So.
Oh, I would defer to, for council.
For council, do you have a comment on that?
Sorry, one more time. Could you repeat that?
No worries. I'm sure you're busy. I suggested that we have the final candidates for mayoral position come and give us a presentation at one of our meetings. Is that permissible? Since we are representation of the mayor, you would think that, well, anyway, I would like to hear from you.
I mean, you always have the option to reach out and ask if they would come and talk to you in that capacity. Beyond that, I think it would be hard to do it as a requirement, but if you wanted to just reach out and ask them to come and talk to the council, I think that would be permissible.
Good. What do the members think about that? I'm getting shrugs. Since we represent the mayor, my thought is that I'd like to hear about the mayor's the candidate's priorities. Now, maybe that's better postponed until after the election and the mayor is selected, and then we hear from the mayor. But I just wanted to propose that. Any comments or suggestions? Shane, go ahead.
Thank you. As a candidate myself, I know that we were invited, or some candidates accepted the invitation by the MEO to do the 54th annual Kūpuna luncheon next month on July 25th. So I think candidates will be there, and I'm sure the mayoral candidates will also be there, and 400 Kūpuna will also attend as well. So I mean, and then to Kahu's point about the federal government, it looks like the honorees are U.S. Senator Brian Schatz and Carolyn Mossman. So I mean, I'm not sure if that we're attending the event. So it looks like that's more for me anyway, more of an event to have the Kūpuna present, for them to, you know, or the candidates to share any of their platforms. But that was my input. Thank you, Chair.
Okay. John, you had a comment?
I think what the honorable councilman said kind of reflects what I'm thinking, that the government that works the best is the government closest to the people. And because of our proximity in terms of our culture and our relational value we attribute and assign to all of our activities, including government, I think that is going to be our saving grace, is being as intimately involved and relational to everybody who is in our government. We know who they are, they know who we are. And in fact, the survey that I took, I put there, you know, what will help? And I said, interestingly enough, in an aging network, I think civic education can always be a help at every level of life. But civic education, because I think it's eroding, you know? And so I like the idea of the Kūpuna luncheon, although I don't think I can afford to go, but Molokaʻi, that's okay. I'll be there in spirit, but you know, that reminds me, it's about how intimate we are with our government and who do we know among those who govern us. We should know all of them because they reflect who we are. So I put that on the survey somehow. Kalamaya, I know I'm kind of quirky, but that's the way my mind goes. Thank you.
That's why we love you.
Yeah.
Okay. Right. So mahalo. I think we've exhausted that. You have plenty of ideas. We'll get the survey approved next meeting, and the next meeting will be on July 14th at 12:30. We'll continue to do it in a hybrid manner. If there are any changes, they'll be reflected in the upcoming agenda. Mahalo to everybody who stuck it through for the 2.25 hours. If there's no further business, we are adjourned. Oh.